What is Jardiance? Empagliflozin? Jardiance, empagliflozin, is a prescription medication designed to help manage blood sugar levels in individuals aged 10 years and older with type 2 diabetes. It is typically used in combination with a healthy diet and regular exercise. Beyond its role in diabetes management, Jardiance, empagliflozin, is also approved to reduce the risk of serious complications, hospitalization, and death in adults with heart failure or chronic kidney disease, CKD. Jardiance, empagliflozin, belongs to a group of medications known as sodium glucose cotransporter 2, SGLT2, inhibitors, which help the body remove excess sugar through the urine. Comes in tablet form and is usually taken once daily by mouth. Common side effects may include urinary tract infections, UTIs, yeast infections, and mild weight loss. What is Jardiance, empagliflozin used for? Jardiance, empagliflozin, has several important medical uses, including improving blood sugar control in people with type 2 diabetes, age 10 and older, when combined with diet and exercise. Lowering the risk of death from heart-related complications in adults with type 2 diabetes and heart disease. Reducing the risk of hospitalization and death due to heart failure in adults. Slowing the progression of chronic kidney disease, CKD, and reducing related hospitalization and death risks. How Jardiance, empagliflozin works. Jardiance, empagliflozin, works by blocking a protein in the kidneys called SGLT2, which is responsible for reabsorbing glucose and sodium back into the bloodstream. By inhibiting this protein, Jardiance, empagliflozin, allows sugar and sodium to pass into the urine instead of remaining in the blood. For type 2 diabetes, Jardiance helps lower blood sugar levels by removing excess glucose through the urine. For heart failure, by reducing sodium reabsorption, Jardiance decreases fluid buildup, allowing the heart to pump blood more efficiently and with less strain. For chronic kidney disease, CKD Jardiance improves blood flow through the kidneys and helps protect them from further damage, slowing the progression of CKD. What are the side effects of Jardiance, empagliflozin? Like all medications, Jardiance, empagliflozin, can cause side effects. Some are mild and may improve over time as your body adjusts to the medication, while others may require medical attention. Common side effects: urinary tract infection UTI, 8 to 9%. Vaginal yeast infection in females, 5 to 6%. Upper respiratory tract infection, 3 to 4%. Increased cholesterol or fat levels, 3 to 4%. More frequent urination, 3%. Other possible side effects: genital or fungal infection in males, joint pain, nausea, increased thirst. Serious side effects: seek medical attention immediately if you experience signs of a severe allergic reaction such as swelling of the face, tongue or throat, rash, or difficulty breathing. Symptoms of high ketone levels in the blood, ketoacidosis, including nausea, vomiting, stomach pain, unusual fatigue, excessive thirst, dry mouth, fruity-smelling breath, or trouble breathing. Jardiance, empagliflozin dosage forms and cost. Jardiance, empagliflozin, is available as an oral tablet and is typically taken once daily. Comes in 2 strengths, 10 milligrams and 25 milligrams. The average cost for 30 tablets of Jardiance 10 milligrams is approximately $619.89 with a GoodRx coupon, which reflects an 18.64% discount from the average retail price of $761.95. Typical dosing for Jardiance, empagliflozin. The usual recommended dose of Jardiance, empagliflozin, is 10 milligrams taken once daily in the morning, with or without food. For people with type 2 diabetes, your healthcare provider may increase the dose to 25 milligrams once daily if additional blood sugar control is needed. Never change your dose without consulting your prescriber, as doing so could increase your risk of side effects or low blood sugar. Pharmacist tips for taking Jardiance, empagliflozin. Timing and food. Take Jardiance in the morning, with or without food. Stay hydrated. Jardiance, empagliflozin, can cause dehydration or low blood pressure. Drink plenty of water throughout the day. If you feel dizzy when standing up, hold on to something stable or sit down until the feeling passes. Prevent infections. Because Jardiance increases the amount of sugar in your urine, it can raise your risk for urinary tract infections, UTIs, and yeast infections. Maintain good hygiene by showering after exercise or hot weather, and wear breathable, natural fabrics such as cotton to reduce moisture buildup. Avoid alcohol. Alcohol can increase your risk of dehydration, frequent urination, and low blood sugar. It may also worsen heart-related side effects. Limit or avoid alcohol while taking Jardiance, Empagliflozin. Before surgery, inform your healthcare provider if you're scheduled for surgery or a procedure requiring fasting. Jardiance can increase your risk of ketoacidosis, high ketone levels. When you're not eating normally, your doctor may advise you to temporarily stop taking Jardiance and restart it once you've recovered. Miss dose. If you forget a dose, take it as soon as you remember. If it's nearly time for your next dose, skip the missed dose, never double up. Low blood sugar risks. Jardiance, Empagliflozin, can cause hypoglycemia when taken with other diabetes medications. Watch for symptoms like shakiness, confusion, or a rapid heartbeat. If your blood sugar drops below 70 milligrams per deciliter, follow your treatment plan immediately and call 911 if symptoms become severe. Pregnancy and breastfeeding. Jardiance is not recommended during the second and third trimesters of pregnancy or while breastfeeding, as it may harm the baby. If you're pregnant, planning to become pregnant, or nursing, speak with your healthcare provider about safer alternatives. Healthy lifestyle. Continue following a balanced diet rich in fruits, vegetables, and whole grains. Avoid foods high in sugar or refined carbohydrates, and exercise regularly to help manage your blood sugar levels effectively. Jardiance, Empagliflozin, is a highly effective medication for controlling blood sugar levels and improving heart and kidney outcomes in adults with type 2 diabetes. To get the best results, use it exactly as prescribed, stay well hydrated, maintain good hygiene, and keep in regular contact with your healthcare team.